Hello, this is Dr. Eric Bricker, and thank you for watching A Healthcare Z. Today's topic is why hospitals will always cry poor. Now, we're going to start off with a true story, and this is the story of Rick. Now, Rick is an elderly gentleman that lives in my community. I'm going to guess and say that he's in his mid-70s. Now, Rick has Parkinson's disease. Now, it's pretty mild, and yes, he has sort of the associated tremor. Now, Rick never married, and he lives on his own in an apartment. Okay, so it's pretty good. He's living independently in his mid-70s with Parkinson's. Now, Rick gets pneumonia and has to be hospitalized. And it turns out that he has to go into the ICU. His pneumonia becomes severe enough that actually it spreads from his lungs into his bloodstream, and he has a bloodstream infection. And so he is, and I hear about this through friends of friends, that Rick is hospitalized. Okay, now, I don't hear any more. About 2 months later, I run into Rick at the grocery store. And guess what? Rick looks great. I mean, he is, I catch him kind of right as he's walking off the curb, and he handles the curb just fine. He sticks out his hand to shake mine, to say hello. I mean, oftentimes when seniors, get pneumonia and they become hospitalized, a lot of times they get delirium, and their brains, their cognitive function kind of decreases, and it doesn't come back very quickly. It can last months. And Rick was super sharp, and he looked great. So what's my point? My point is, that was a miracle. A gentleman in his 70s with Parkinson's disease having pneumonia that spread to his bloodstream, like, in many situations, in the not too recent past, like, that was a death sentence. And he was able to survive. It was a miracle, frankly, what the hospital and the nurses and the physicians and the respiratory therapists and all the staff were able to accomplish. It's a wonderful thing. Now, let's get now to the finances of Rick's hospital stay. Okay, so his hospitalization, probably, these are just rough estimates of what the costs are, right? So his hospitalization probably cost, like the actual cost to the hospital, was probably about $100,000. Now, Medicare probably reimbursed the hospital for that stay about $50,000, which means that that hospital lost about $50,000 for Rick's hospital stay. Now, the hospital sees people like Rick with a chronic disease who get pneumonia and end up in the ICU. They see them all the time. I would see patients like that all the time. So let's just multiply that by 5 Ricks, because it's very common for hospitals to get 5 Ricks, sometimes on a daily basis. That means the hospital is going to lose $250,000 for those 5 Ricks. Now, let's see what the hospital does to manage losing $250,000. And I'm going to use the example of scoliosis, but you could replace it with another hospital service as well. So scoliosis is a lateral curvature of the spine, and it typically happens in young women, and it can be actually remedied through extensive spine surgery, like super extensive spine surgery can be used to actually straighten the spine. Okay, fine. So the actual cost, now it's actually you actually have to go to the ICU after the surgery is done, but the people generally recover pretty quickly, and they're generally out of the ICU within about 24 hours, and then, maybe a 5-day hospital stay total. So let's say that the actual cost for the scoliosis surgery is $50,000 for the hospital to actually perform that surgery. Now, most people with scoliosis are kind of women, between the ages of, in their teens to kind of, let's say, early 40s or late 30s, right? So they're typically going to be in an employer-sponsored plan. So it's actually going to cost that employer-sponsored plan $352,900 for that. Now, why the $352,000? Well, it's administered through a health insurance plan, which is allowed to have a loss ratio of 85%, which means that when you take the $352,000, multiply it by 0.85, that gets you to $300,000. So that's the contracted rate that the hospital has negotiated with Blue Cross United, Cigna, Aetna for that scoliosis surgery. And these scoliosis surgeries can easily cost that much. So the employer plus the insurance combined pays out the $352,000, which after you take out the loss ratio gets you down to $300,000. So it actually costs the hospital $50,000 to perform it. So that's the negative $50,000, and plus the $300,000 means that the hospital made $250 grand for this scoliosis surgery. So that $250 grand from the scoliosis surgery offsets the $250,000 loss from the 5 ricks with pneumonia. And that process is referred to as cross-subsidization. So all hospitals in America use cross-subsidization to make up for Medicare underpayment. In this case, it was $250,000 of Medicare underpayment. Now note, in order for this cross-subsidization occurs, it costs about $52,000 in administration costs. That's the 15% in the loss ratio, which is why it ends up costing actually $352,000, because you have to take into account the $52,000 in administrative costs that goes to the insurance company, that goes to their employees, that goes to their marketing, that goes to paying brokers and consultants their commissions, that goes to their profit margin. So what that means is that in order to administer this cross-subsidization as it exists today, for every $250,000 in Medicare underpayment, there is $52,900 of administrative costs. In other words, 21%. If you take $52,900 divided by $250,000, that gets you 21%. So in other words, this employer-sponsored welfare, this employer-sponsored cross-subsidization of Medicare underpayment, has an administrative cost that's about 21%. You can think of that as the friction in the system of the money that's being lost to facilitate this process. Now keep in mind, insurance carriers want this to happen, right? Because the more expensive, the more Medicare underpayment to the hospitals, the more the hospitals have to overcharge their employers, which means that the insurance companies get to keep 15% of a larger number. So right now, this structure is what exists today, this employer welfare state of cross-subsidization of Medicare underpayment is good for insurance carriers. And oh, by the way, it's also good for brokers and benefits consultants that the insurance carriers pay to facilitate this process. Now, we're going to talk about the alternative. So, you still have the 5 ricks costing $250,000 to the hospital, but instead, the hospital can actually run its own health insurance company. Whether it be, and there's hospitals in America that run their own health insurance companies. I've made plenty of videos about them in the past. Now, in that situation, that actually incentivizes the hospital to try to decrease the cost of the ricks, to decrease this $100,000 per rick. It actually incentivizes the hospital to actually try to decrease the $50,000 that it actually costs to perform the scoliosis surgery, and it incentivizes the hospital to actually decrease the $52,900 of administrative costs. So when a hospital owns the insurance plan, it actually aligns the incentives of the hospital that's administering the care to actually do so in a more cost-effective fashion. Now, I will tell you that that is a hugely daunting task. That is the reason why more hospitals in America haven't done it is because 1, it's really hard to do, and 2, frankly, they don't want to do it. So it's an incredibly daunting task. The vast majority of hospitals in America, they lack the will and they lack the skill. They don't have the people, processes, or tools to be able to do that. Now, what's the alternative? The alternative is what they do today, which is 1, they cry poor and they lobby to the government and to Medicare to try to increase that reimbursement as much as humanly possible. And then they also cry poor to the insurance companies and the employer welfare state for healthcare in America to increase that $352,900 as much as they can. So, what's the point? The point is that we see hospitals crying poor. This is why hospitals cry poor. And they will continue to cry poor until they decide to address the hugely daunting task of actually establishing their own health insurance companies. Now, will they do that? When will they do that? That's to be decided. But now you understand why hospitals will cry poor. And that's my point for today. Thank you for watching A Healthcare Z.